Winnie, whenever you're ready.
Okay, good evening, good morning. Hello, my name's Winfrida and I am going to present today about moderation analysis, but also it's a new field that it's a new analysis that I'm trying to understand. So feel free to add more according to your expertise. Yeah, so I believe we can also learn from each other. And so I'll talk about moderation analysis, and I'm going to cover some definitions. Mainly, I'll be trying to look at the difference between moderation, mediation, and interactions, because these are some terminologies that are usually confused. And why do we need to include moderation in analysis or in our research work? Steps in conducting the analysis, and I'll give a theoretical example of how to conduct it in a study I'm trying to use moderation analysis, and some references for my today's presentation. So just a brief background. Usually when we have a study and we want to look at we're usually interested to look at the relationship between exposure and outcome variables. So in epidemiology, they're called exposure and outcome variable, or as in statistics, we call them dependent or dependent variable, predictor variables. So they're different terminologies, but we are usually interested to look at the effect of your independent variable on dependent variable. And when you see there is a relationship, usually from the epidemiological perspective, we're usually told that it's not enough for you to be very certain on the relationship that you see between your dependent and independent variable. So let's say if you have a data on smoking and coronary heart disease, like smoking as your independent variable, and you want to look its effect on coronary heart disease as your dependent variable, and you find that there is an association, maybe it's increasing the odds of getting coronary heart disease by a certain amount, it's always not enough to be satisfied by that. We have to think of the role of chance, role of bias, any bias that we introduced in our study. But also there is another concept. It's important to think of a third variable that might influence the relationship that we are seeing in the analysis that we are doing. So that third variable that might be giving a possible explanation of the relationship that you are seeing between your dependent and independent variable can act in different ways. Traditionally, we are more familiar with confounders, and we usually do adjusted analysis to control for them. But that third variable can also act as a mediator. So it can act on the causal pathway, such that when, let's say, you're interested to look at the effect of diet on coronary heart disease, there might be a variable like blood cholesterol, which is mediating that relationship, or it's acting on the causal pathway. Like if you take poor diet, you'll first have high blood cholesterol, and the blood cholesterol is the one that would cause coronary heart disease. So this third variable, you won't control for it like how you would adjust for confounders. You have to understand the mechanism that third variable is trying to affect the relationship between your dependent and independent variable, so that you can handle it in the analysis accordingly. So this concept brings us to the concept of moderation. So when we talk about moderation, usually also we are referring to a third variable that is trying to explain for who or for what the effect that we are seeing between our independent and dependent variable is happening. So when conducting moderation analysis, it allows us to test for the influence of a third variable, I'll call it Z, on the relationship between your dependent and your independent variable X on your dependent variable Y. So rather than testing a causal link between the two variables, your X and Y, dependent and dependent, the moderation test tries to tell you for who and under what condition does the relationship that you are seeing occurs. So I'll give example, like you can say, if you use social media for a long time, it can predict your levels of loneliness. But this relationship can be different. Maybe it can be worse for adolescents compared to adults. So that variable of age, which is saying someone is an adolescent or an adult, would be acting as a moderator for the relationship between use of social media and loneliness. And moderators can either strengthen the relationship that you are seeing between your dependent and your independent variable. They can weaken that relationship, or they can even reverse. So maybe when you do your crude analysis, you might find an increased risk of getting your outcome when you have a predictor X. But when you take into account moderation, you might find that that relationship is reversing. Maybe it's even a decreased risk. So it's very important to take into account moderators. Sorry, can you hear me well?
Yeah.
Okay. So one thing about moderation, when we talk about this hypothesis, it's unidirectional. Like, so here's an example. I have a figure X causing Y. So the moderation, the moderator hypothesis we are referring to is still unidirectional, like it's always referring to the effect of X on Y. It doesn't change direction. And I'll later say why I am emphasizing on this, because this would be the main difference between interaction and moderation. So the moderator variable would be always referring to the effect of X on Y. And the presence of this third variable, which we call moderator variable, some literature, you'll see they're referring to it as a causal interaction effect or effect modifier. So they have the same meaning. And this, you see, like some people call it causal interaction effect, and they're already bringing that component of interaction. So another terminology which I want to bring about, which I felt like it's important when you're talking about moderation, is mediation. And when we talk about mediation, we are referring to the mechanisms of effect underlying a pre-established causal statistics. So you're trying to talk about how, like you have an existing relationship between two variables, X and Y. It can be theorized by having another third variable, an intermediate variable. So as I said, for the poor diet, how it can cause coronary heart disease, but you can have the intermediate variable would be blood cholesterol. So that's when you're talking about mediation. You have a third variable which is acting on the causal pathway. So for you to get, for X to cause Y, it passes through a third variable called a mediator. So this is when we're talking about mediation and mediation variable. And some refer to them as intermediate variable, explanatory link, and literature could have more names to call the mediation. So the main difference between mediation and moderation, while mediation is trying to answer the how and the why of the association that you're seeing, moderation will be answering when and for who does it happen. And so this is just diagrams trying to show the differences, that mediation, the mediating variable would act on the causal pathway, While for moderation, the moderating variable would not be direct on the causal pathway, but it will be trying to modify the effect of your independent variable on your dependent variable. So why there is always confusion between these two terminologies, mediation and moderation? One could be due to the similarities in the two words. They are very similar and usually they're mentioned together. And mainly, I think it's because of the purpose in which they are used for in research. Both of them, they're trying to understand the theories. They're trying to refine theories they are both theories for refining and understanding the causal relationship between your exposure and your outcome. But they can also be combined. So you can see a lot of articles doing moderation mediation analysis. And so you can sometimes have a combined effect, which would provide a more powerful intellectual framework for specifying and testing multivariate hypotheses. So when you have a combined mediation moderation analysis, an example would be trying to answer, how does X manage to impact Y? Is it via intermediate effect on Z? This is mediation. Or further, under what condition does W, a moderator, under what condition of W does Z express this role, moderation? So there are some papers which you would see they're trying to do mediation and moderation, and they're doing mediation moderation analysis combined. So why is it important to include moderators and mediators in our studies in general, including mediators and moderators in your research work? Will help you to go beyond understanding the simple relationship that you're seeing between your dependent and your dependent variable. It will give you the clear picture of how variables are interacting in the real world. But also, it's very important to consider the complex and causal relationship that is truly happening in studies. It's not like cigarette smoking would also cause, lung cancers directly. We have confounders, we have moderators, we have mediators. So it's important to have the true picture of what is really happening. And mediators are part of the causal pathway of effect, and they will tell you how and why the effect takes place, while moderators will help you to judge the external validity of your study, because you'll be able to identify the limitations of when that relationship occurs. Maybe that effect you are seeing is only occurring in younger people and not the older ones. So with adding moderators, you'll have more external validity of your findings. Okay. So I want to introduce a terminology called statistical interaction. And why am I bringing statistical interaction? Most of the people are familiar with interaction, but so it's when I was trying to understand about moderation, I thought it's totally completely different thing. But how you handle it in analysis, it's 100% as how you do interaction. So what we mean by interaction in statistics, in when you have a combined effect of two variables to cause a third variable. But so the difference when you talk about interaction and when you talk about moderation, it's I would say it's very theoretical. I don't know, because in interaction, you would be talking about combined effect of two variables. But when you're talking about moderation, you would be talking about how a third variable affects your independent variable to cause the dependent variable. But in terms of how you do the analysis, it's the same thing. So in that regards, when you're talking about statistical interaction, you're literally talking about a bidirectional hypothesis. So when I say combined effect of two variables, in this equation, if you can see, assuming Y is your outcome, X and Z are your predictors. So when I say combined effect of two variables, I mean of X and Z. So in the examples I was saying about level of loneliness and social media being a predictor and age being a moderator, when I'm talking about statistical interaction, I am not defining any variable to be modifying the effect of the other. I am talking about a combined effect. But in terms of moderation, I would be defining one variable to be independent variable, the other one dependent, and the third variable as a moderator. So the difference between statistical interaction and moderation is mainly on the applicability, I would say, but in terms of how you handle them in the analysis, it's the same way. So you'd need to, when you're doing moderation analysis, you would include a statistical interaction term. And this statistical interaction term is a combined effect of your independent variable and your moderating variable, and you'd see how do they affect your outcome variable. So how would you know you need to do, you have interaction in your analysis? Usually, I've tried to come up with a simple table. When you have a certain, like we have three different situations, and we have crude estimate and we have adjusted estimate, and we have stratum specific estimates in the middle. So the stratum specific estimate are for the third variable. For the third variable, let's assume we don't know if it's a confounder or it's an effect modifier or a mediator. So for you to know the third variable that you're dealing with, usually we do adjusted analysis traditionally, like from crude to adjusted. But for you to know, maybe I shouldn't do adjusted analysis. The variable I am dealing with is an effect modifier, or it's it's interacting. It's not confounding. It's modifying the effect of independent variable. The easy way is to look for the change from your crude estimate to your adjusted estimate and the stratum specific estimate. So if your crude, the stratum specific estimate and adjusted estimate, they're similar, you don't need that third variable you're dealing with, you don't need to control for. It's not a confounder. It's neither an effect modifier. When the change from your crude estimate to you have a change from crude to stratum specific estimate, and the stratum specific estimate are almost similar to adjusted, the third variable that you're dealing with is most likely a confounder. But when you have a crude estimate and the stratum specific estimate as different from each other, this might suggest you're dealing with an effect modifier. So it's important for you to report the stratum specific estimate for your third variable. So it means the effect of your exposure, sorry, I'm switching words, like the effect of your exposure to your outcome is different in the stratum of your third variable. So if the effect is different in the stratum, it means there is effect modification. The effect changes on that third variable. So it tells you should consider dealing with the third variable as an effect modifier. This is from the statistical point of view, but it's very important to have not to rely on this. It's important to do literature to try to understand how different variables operate in reality. So, but statistically, this can try to guide you to know, should I control for this third variable as a confounder, or there is an effect modification, so I should treat it as an effect modifier. So I can either do an interaction, or maybe you're really dealing with a moderator, sorry. So although the statistical method are used to test the hypothesis of interaction, they can also be applied to hypothesis moderation. But for you to conclude that a certain hypothesis of moderation, but for you to conclude moderation exists, it's very important to have evidence, pre-existing knowledge from either past literature finding, from different frameworks, or theories or other top-down sources of knowledge that can help you to know if the variable should be handled as a moderator or simply statistical, or whatever you're seeing is simply statistical interaction. And we should remember that moderation is hypothesis. Moderation is hypothesis whereby a causal relationship is specified, not something one can only conclude on statistics. So it's very important to have prior knowledge for you to talk about that moderation you are talking about in your study. So statistics alone cannot answer a hypothesis of moderation. You need to have a sound conceptual understanding on that relationship between your dependent and dependent variable and the third variable that you're going to carry it as a moderator. So in terms of analysis, so if you already have enough evidence for you to take your third variable as a moderator, you would, in terms of analysis, you would conduct your moderation analysis as how you do your interaction analysis. So you would compute the interaction term between your two variable, X, assuming is your independent variable, and Z, your moderating variable. And then you would fit a regression model with your two predictors, X, and your predictor X, your moderator Z, and XZ, which is the interaction term. And then from the regression output, you will see if the XZ, the interaction term, is statistically significant. If it's significant, then you can interpret it. If it's not, you shouldn't interpret the interaction term. You shouldn't consider that moderating effect. And you can display the moderating effect graphically if you find the interaction term significant in your model. So an example would be, so for a study, let's say, which tries to look for the effect of brief negotiation or intervention on outcomes among patients with alcohol-related injury. And one of the outcomes, let's say, is binge drinking days or audit. And you can have an hypothesis that we expect the outcome, we expect the intervention to act, the effect of the intervention to be different depending on, according to age group. And you already have enough evidence from literature which says when you have interventions which behavioral change intervention, they're expected to have different effect to younger people compared to older people. So you can already use age as a moderating variable. So specifically, it's expected that the intervention effectiveness may differ between younger and older participants. So we can use age as a moderating variable to look at the effectiveness of a brief negotiation or intervention on the outcomes among injury patients. So our outcome variable, we can define it as binge drinking days, and predictor variables, it can be BNI compared to getting standard care. And moderating variable is age. We can categorize it into two groups, younger and older groups, but you can also fit your moderating variable in different ways. It can be fit as a continuous variable. It can be fit as quadratic. It depends with your study objective. So, and then you can run a regression model with the outcome variable and dependent variable. So the BNI can be dependent variable and age can go as a covariant. And then you can add the interaction term. So the interaction term here would be age and BNI. And interaction term simply means multiplication. And I know the command for stata. So if your variable is BNI and age is age, you just put the asterisk. So it's multiplication. And if a significant interaction term would, if you, from the model you get a significant interaction term, it would indicate that age moderates the effect of BNI on the outcome. So if you find that the interaction term is significant, you should report the effectiveness of the intervention per age group. So, okay, sorry. So if you find the age is not, you can find it is significant, then you can go and interpret the stratum-specific estimates for age that you found. But if you found age is not significant, you can do further explanatory analysis. You can try to model age as a quadratic, or you can try to see how best can age act in the model. So depending with your theory, you can try to look for different explanatory analysis that would work, also based from other literature. And if the interaction parameter is significant, you should report the effectiveness of the intervention among the different groups. So among younger participants, the BNI led to YY% reduction in alcohol consumption. In contrast, among older participants, the reduction in alcohol consumption was smaller at ZZ%, suggesting the brief negotiation intervention was less effective in older individuals. And so it's also from literature, it's common and it's advised to report your interaction results using graphs. So when you have a graph showing the results from interaction, if the more parallel the lines are, it means the less interaction you have. But when the lines are more, they are far away from, they are diverging from each other or converging from each other, the stronger the interaction effect in your analysis. So the more your moderating variable is modifying the effect of your independent variable on the dependent variable. Thank you. I have some references that I've used to prepare my slides, and I'll share. Oops, sorry.
You're fine.
Thank you.
This was a great presentation, Winnie. Thank you so much.
I invite questions and sorry, I keep removing it. I invite questions and inputs, because also it's something I have been trying to learn.
Yeah, no, totally. I think you did a great job in showing us how the different hypotheses, like the differences between mediation, interaction, moderation, the figures you used, the workflows there are great. So congrats, was a very, very clear presentation. One question that I have, maybe you can discuss a little bit with the group as well, is would you use moderation or mediation on what kind of study design? Would a secondary analysis like a cross-sectional study work, or should we focus on something like a randomized design where you have a cohort of patients? What can you tell us about that?
Okay. From my opinion, from the understanding I have on moderation and mediation, I think you can use it even in observational studies like case control, cohort, yes, and even experimental studies. But I think what would be important is how you have collected the information. So let's say for the case of mediation, we are talking about an intermediate variable. But did you ask about, like, in terms of asking that question in your data, how was it framed? At what time point are you collecting it? Should we really trust the duration that you ask that question happening is somewhere between the causal pathway? But for something like moderation, I wouldn't be worried so much about how the question is asked, because you see how we're even handling it, it's like interaction. So it means it's okay even if when your X and Z are occurring at the same time. So even for cross-sectional studies, but the only tricky part is we would have some limitations in causality. Generally, the cross-sectional studies have
Hmm.
that limitation. Yeah. So I think mainly it's how you would be asking your questions from your data set.
Yeah,
But I've seen
sure.
papers
Sure,
doing
that's
it
great.
for different time. Yeah.
Hmm. Yeah, I totally agree. I think it's just a point that I wanted to expand as well to see how, as you were saying, the way that you do it is just as we do for normal interactions, and just being
Mm.
aware of the limitations or the applications of each study design. It's going to be what's going to dictate the conclusions we can have. But it was great. You can see in the chat that we have a lot of people congratulating you for your presentation. And we have a question. Maybe if you want to look, if you can see the chat there from Tumble Ernest.
How do we compare baseline and endline effectiveness and influence of mediators in interventional and control sites in clinical trials? Okay. So I can answer this, and I think Joao has experience with dealing with analyzing interventional studies. And so the best way would, so a mediator would be a third variable. So effectiveness would be measuring our effectiveness by having a certain outcome variable. So for us to be able, I think it's important to have both information at the baseline and the end line, but I'm not really sure how I would carry out mediation analysis. I haven't tried doing mediation because I've seen structural equation modeling. I haven't tried that, but I know would be comparing the state from the baseline to end line. I'm not confident in answering how would be comparing that change with mediation analysis specifically. If someone can help me.
For mediation, I cannot say as well. What I can tell about moderation is that I tried for following up with the PRACT study, similar to what you're doing with Winnie for the younger adults and the older adults. We wanted to see if things like the sex, the age as well, like older age or the tribe, those kind of demographic information could moderate the effect of the intervention. And
Mm.
so for the effectiveness analysis, what we do is we compare the drinking, which is our outcome, to the intervention. If the patient was intervention or standard care, but also at baseline and follow-up. So you basically are adding another variable there, which is the time. So baseline and follow-up, regardless of what that is. And you would add a third variable, which is your moderator. I can tell you from what I done is that we have as the more variables you add, your sample size kind of reduces, especially if you have a categorical variable with a lot of classes. Like for instance, we collect tribe for the patients at KCMC, and we can have more than 10 or 12 different tribe reported. Or if you try age and you use you try to categorize age and you have a lot of age buckets. Essentially, the number of participants you have in each of those classes reduces, and then the model cannot draw, the correct statistical inference from that. So the challenge we were facing to Ernest's question was the sample size. And what I would assume is that whenever you have the biggest sample you have, the easier the time you're gonna have to model this. But this is the tricky part that we are facing now. But it can be done for sure.
Thank you, Joao.
Then from Doreen, she says, "Congratulations, Winnie." She has a question about if moderators can also be mediators at the same time.
Mm. Uh, you can, I haven't seen I'm trying to think the situation. I don't think so, but you can do an analysis whereby, because if it's on the causal pathway, it's already a mediator. So you wouldn't be thinking of it as a moderator. So that's one way I would handle that variable. But you can do an analysis by handling both mediators and moderators in the same model. And that's called a moderator mediator analysis. So you could have two variables, one acting as a moderator, the other one acting as a mediator, and you handle them at the same time in the analysis. But a same variable acting as a mediator and moderator, I don't think so. I can't think of an example, because if it's already on the causal pathway, I would take it as a mediator. Nemes has a question. Is it applicable in both homogeneous and heterogeneous population? Nemes, can you kindly elaborate the question for me? Sorry.
Yeah, I was asking if this method is applicable in a population with the same characteristic, and if there is no diversity in a certain population, and there is a, if is yeah, in both a heterogeneous and a homogeneous population.
Okay.
Yes.
I would say yes, it's applicable despite the population that you're dealing with. So the only thing which would be important, you would need to do further analysis when you have groups which have similar characteristics. If you have groups with like homogeneous population, it's important to take into account that factor in the analysis, and that would be a different component. But in terms of moderation and mediation, you can still do it regardless the population. But you would need to take, if maybe let's say you have individuals coming from, you're doing a clustered, you have individuals coming from the same clusters and others, like you already have individuals who are homogeneous in your data, you have to take into account that component in the analysis, incorporating it into the moderation or mediating analysis. So that would be a different handling of that. Maybe if you've violated certain assumptions, if it's regression of, let's say, independencies. Yeah, so it would depend. But yes, you can apply it in any population. And I allow inputs from others.
Do we have more questions or comments for Winnie? Nope. All right. Again, I want to thank Winnie for your time and presenting to us. This was great. We have this recorded. It's going to be available for anyone that is doing analysis in the future and wants to learn more about moderation and mediation. I know that Doreen is interested. I know that I am doing some analysis as well. And I'll definitely look at the references you had on the slides there, Winnie. Thank you.
Thank you so much.
Thank you all for coming. Let's see each other again next week.